afternoon, and welcome to the April 2024 Pitt County Board Department of Social Services Board meeting. I would like to call the meeting to order. Can we start by observing a moment of silence? Thank you. Do we have any revisions to today's agenda? Can I have a motion to accept today's agenda?
Please do.
Motion to accept.
Second.
Second.
All in favor?
Aye.
Opposed? Any discussions? Do we have any public address to the board?
No, sir.
Thank you. You all should receive last month's minutes. Are there any changes to those minutes?
Make a motion to approve.
Second.
Second.
All in favor?
Aye.
Opposed? Any discussion? All right, next we're going to have recognitions from the director.
Good afternoon, everyone. We'd like to first take the first part of our introductions for our new hires. And so when I call your name, if you could please step forward to the microphone, tell us your name, a little bit about yourself, and where you're working here in Pitt County. Quintina Little, and you can feel free to correct me.
Good afternoon. My name is Cortina Little. I am originally from Martin County. I came on board March the 11th, and I'm a child welfare supervisor.
Welcome.
Thank you.
Welcome aboard.
Oh geez, I'm really gonna, Vic Alcasabeni, and I probably really, I apologize.
Oh, I can understand that one.
Good afternoon. Vic is a nickname, Eamon El Casabani in North
Put your
Carolina.
mic up a little bit.
Good afternoon. I'm Eamon El Casabani. Vic is a nickname. In North Carolina, I would say I'm from Rocky Mount, Ashe County. Income maintenance caseworker, redetermination, family and family and children department.
Welcome.
Thanks.
Thank you.
Thank you.
Welcome aboard.
Welcome.
Matthew Simpkins.
Hey, I'm Matthew Simpkins. I'm in the Food and Nutrition Services and the Redetermination Unit, and I'm happy to be here.
Thank you. Welcome
Thank
Okay,
you.
where
aboard.
he say he from?
Food and Nutrition.
What county was that? Oh, you live here?
I'm in Food and Nutrition Services.
Oh, okay. Found one from right here. That's different.
Erica Barnes.
Hello, I'm Erica Barnes. I'm in the Redesign Department for Family and Children's Medicaid.
Welcome.
Welcome, thank you.
Good, welcome. That's
Turkia,
another Pitt County one?
she didn't say. Turkia McCoy. Good afternoon, how are you?
Good afternoon. Hi, my name is Takia McCoy. I am a social worker in the Child Permanency Planning Unit. I come from Sampson County with the CC4C and SIM Heart program.
Yancy,
Welcome
Thank
aboard.
welcome.
LaQuasha Spites.
Hey, my name is LaQuesha Spades, and I am an intake adult Medicaid worker.
Welcome.
Pitt County?
Welcome aboard.
Andrina Marshall.
Good afternoon. I am Andrina Marshall. I am from Vanceboro, North Carolina. I am in intake for Family and Children Medicaid.
Welcome
Right up
aboard.
the creek.
Buffy Tyson.
Good afternoon. My name is Buffy Tyson. I am an intake caseworker for adult Medicaid, and I've resided in Pitt County all my life.
Welcome aboard.
See, it's good to have a homie right here, you know, want to stay here.
That's right.
And want to stay here at this age. That's why it's important to me that we keeping some people here.
Rolanda Nobles?
Good afternoon, everyone. My name is Raylonda Nobles. I live in Pitt County, and I'm a social worker too in the Family Support Services Unit, and I work in child care.
Thank you. Welcome aboard.
Corrine Hartley? Okay. Kimberly Gaylor?
Hi, my name is Kimberly Gaylor, and I moved to Pitt County in 2017. I was a mortgage underwriter for 22 years, but now I'm an income maintenance caseworker.
What county you say you for 22 years?
I was a mortgage underwriter, so I think that the income and asset piece of it to be an income maintenance caseworker works.
Welcome aboard.
Thank you.
Happy to have you.
Lucretia Walston?
Hello, I'm Lucretia Walston. I am in adult Medicaid redetermination.
Welcome aboard.
And Passion Black?
Good afternoon. My name is Passion Black, and I'm coming from the Pitt County Health Department, and I'm currently in long-term care, adult Medicaid, in the redetermined unit.
Thank you. Welcome aboard.
Mr. Chair, may I say something? I ask permission to speak right now because I know you are curious as to why I'm wondering about where you come to Pitt County from, or if you remain to Pitt County. With economics the way they are, I'm always pleased to know that you're a little bit younger than I am, so when the young folks stay here and come from other places, it makes me feel good for economic sake. So as a county commissioner, I learn things when I get to meet new people. Thank you so much for your patience with my outbursts. In addition to the board.
Thank you. Thank you.
Thank you.
We have a recognition of a retirement now. Janice Purnell, if you'd like to step forward.
Hello, I'm Janice Purnell, and
You're coming right on over here. We're not gonna let you get away with the microphone. And I remember you just a couple of months ago for an excellence. And now you're leaving us.
Today is my 65th birthday. I gotta go.
I heard that one.
I'd like to read this to you on behalf of the Department of Social Services in Pitt County. This is a resolution honoring Janice Purnell for her years of service with Pitt County Social Services. Whereas we are here today to express special recognition to Janice Purnell and to honor her for her distinguished career with the Pitt County Department of Social Services. And whereas Janice Purnell started with Pitt County Social Services on October 13, 2014, as an income maintenance worker 1, and was reclassified to an income maintenance caseworker 2 on October 25th, 2015, until her retirement on April 30th, 2024. So you have a little time. Whereas Janice Purnell has worked constantly for the betterment of children and families in, with the Pitt County Department of Social Services and the community, and whereas the Pitt County Department of Social Services wishes to express its sincere appreciation to Janice Purnell for her dedication to the outstanding performance of her duties during her tenure. And whereas this proclamation is presented to Janice Purnell to serve as a reminder that although she is retiring, she will always be remembered as a valued employee dedicated to both her position and the community. Now therefore, I, Sharon L. Rochelle, Director of Pitt County Social Services, and on behalf of our governing body and the
did want to say something.
Oh, great.
I have enjoyed working here. My only regret is that I didn't think of it sooner. It never entered my mind until I lost a job I had for 23 years through no fault of my own. I was working at Aramark at the hospital when we lost the account, so I lost my job. And, you know, it's a great place to work, and I thank you for 10 great years.
Oh, thank
Thank
you.
you.
Mr. Work, did you hear
Yeah.
that?
Yes.
Let's give one more round of applause for Ms. Purnell. From the state, or you can be excused. Next, we're going to have the director's report.
So just a couple of items. Our next meeting date will be May 14th. I just want to recognize that April is Child Abuse Awareness Month, and if you noticed on the front of our building, we have our pinwheels out and some signs and a rather large banner that talks about prevention of child abuse. It is also Autism Awareness Month, and just to let everyone know, our security people started. We have one in each building, and they're here full-time from 8 till 5:30. Is that
8 to 5.
8 to 5. So we're very pleased to have them, and appreciate the fact that we have some folks here to keep an eye on things for us. So. Okay. Do we work on the bids next, Jana?
Yes.
Okay. Mm-hmm.
Good afternoon.
Was that me?
No, it was the computer over here.
Oh, okay.
All right, so I am here to open the bid proposals for our SA in-home program. I'll start with the first packet. This packet is from Bayada.
And Candace, while you're opening, could you just explain to everybody here, as well as the people that are watching this, what SA in-home is?
Sure. So our special assistance in-home program and our in-home aid program. So in-home aid actually is where there is an aid that goes into the home to assist with personal care needs. In-home aid program actually supports our APS unit. And so when there's individuals who are found in need of protection due to maybe a lack of caregiver support or personal care needs, we tend to lean on our in-home aid program to send aides out to kind of stabilize that home situation. Not only just for APS programs, but individuals can call in and actually apply for that in-home aid assistance. And we will have a worker go out, the worker assesses the need in the home to determine how many hours of care is needed, and then that is provided by our agency. So currently right now we have a bid, a contract with Bayada. So we posted an ad in the paper for the opening of our bid process. We've received these 3 bids. So today I'll open them, let you know who they are from, what the proposed bid amount is, and then I'll go over some next steps after that.
Okay. Thank you.
We don't usually do this, open bids until we have to do it for social services.
It is.
Okay, and a lot of these packages are packaged different. The order is different, so I just need to locate the contract in each packet. Okay. So the proposed rates for Bayada for fiscal year 2024 and 25 for level 1 care, they are proposing $22 an hour. For level 2, the same, $22 per hour, and for level 3 care, $22 per hour. So their bid is for $22 per hour for the fiscal year 2024, 2025, and that's Bayada. Okay. The second bid is from Action Health Staffing. Action Health Staffing is proposing a bid rate for each unit or hour of service at $26 per hour for fiscal year 2024, 2025.
And Candace, was that rated at levels, or is it just 26?
It's a flat $26 for them. Mhm. The third bid is from Interim Health.
Where?
Excuse me. Interim Healthcare.
Okay.
Interim. Okay, and Interim Health is proposing $21 an hour for levels 1, 2, and 3. All right, so those are the three bids. We have Bayada, Interim Health, and then we also have Action Health. As I stated, currently our contract is with Bayada Home Health at $22 per hour. That contract is to end on June 30th of 2024. So in efforts to have a new contract fully executed by July 1 of 2024, our next steps would be to contact each of these agencies to schedule interviews with each of them. And then once the interviews are completed, we will come back to you here with our recommendations in the May board meeting. Okay. Were there any questions about that process?
Any questions? No, thank you.
Okay, thank you.
Sonia, would you like to come up next?
Good afternoon. On the agenda, it says item for decision, but Ms. Rochelle and I thought we should just let the DSS board know where we stand with our funds for our crisis program and our emergency assistance program. This year, this state fiscal year, the state allocated $727,590,000 to Pitt County for for crisis fund to help with heating and cooling costs. Since that time, we have exhausted all of those funds as of February 27th. There are a couple of reasons those funds have been exhausted. Of course, the needs of our community have increased with the rising cost of everything. And in addition to that, we have had policy changes. Prior to February, the policy required that temperatures be below 45 degrees or above 85 degrees before we could assist individuals with their heating and cooling costs. The state changed the policy that there are no criteria for the temperatures to be part of your eligibility for the program. So of course that increased the number of our applications. We have approved a total of $4,913. I'm sorry, approved the total households of 4,913 individual households. For our Share the Light funds, which is specifically for Duke Energy customers, we were allocated a little over $45,000. We have issued $40,553.90. We have a remaining balance of $4,457.80. For our Neighbor to Neighbor funds, which is donations from Greenville Utilities, and it's specifically for Greenville utility customers. We received a donation in January of $26,741.50. On your report that you have in your file, as of April 3rd, the balance was $1,754.06. As of April 5th, that balance is now $662.84. So we wanted to bring that to your attention to let you know that we've not been able to assist our community. We've had to turn away a lot of our citizens for assistance with their heating and cooling costs. We also have as far as our eviction, we have TANF EA funds. We receive $35,000 each year to help with those citizens who are facing eviction. The maximum amount for those households is $300 in a 12-month time period. As of January 2024, we have exhausted all of those funds as well. And that is the first time ever that we've exhausted those funds. We've requested additional funding from the state, but the state only periodically sends out requests to allocate funds. We don't know when and if the state will send out another request for additional funds. And this is just not an issue that is unique to Pitt County. It is something that's happening across the state because more and more people are in need of assistance. Back in October, I presented to you guys the ARPA eviction program, which is part of the Planning Department's Housing and Homeless Project to DSS, where they allocated $150,000 for us to help use with evictions. We designated that amount to be used specifically for eviction and for the administrative cost. As of today, we have roughly about $86,000. At the request of Ms. Rochelle, we have requested that a portion of that money be reallocated to allow us to use it for utilities for the citizens of Pitt County. And it is on the agenda for the county commissioners for their next meeting for them to amend the ordinance to allow us to use those funds for utilities. So we wanted to make you aware of what was going on within our community as well as our citizens. So we're pinching pennies from everywhere to try to assist and trying to save what little we have, which is less than $2,000 for our more vulnerable population, which includes those that are age 5 and under, age 60 and over, or have chronic medical conditions. So hopefully the commissioners, and we have our wonderful commissioner here who I know will advocate for us at the next meeting, will allow us to, will amend the ordinance so that we will have those funds available. If not, we will not have any funds available until July, and not July 1st, because even though the new fiscal year starts July 1, it takes about approximately 2 to 3 weeks before we actually see those funds. So.
I have some questions.
Yes.
I have a question not because you mentioned the commissioner, but I have a question because when you were making your presentation, I was thinking about the homeless people and those people who were not in shelter and that sort of thing. At what point in the county do we look at that particular item, those that are homeless, or are they homeless or without shelter because they want to be, or what are the reasons? Is there ever a time that we look into that, the homeless, and look into those who are in the shelters?
So unfortunately, our programs in DSS does not include those individuals that are homeless. Those are those individuals who are facing eviction, who have been served with a summary ejection to be evicted from those homes. Those are the individuals that we assist. So we don't have any funding for those individuals. We normally refer them to outside resources within the community when we do have individuals that are actually homeless to assist us, such as Community Crossroads. And now we're actually referring a lot of people to the HOP program. So there are different resources out there that we refer those individuals to, but the program with social services, the eviction program, is what we call TANF EA, Public Assistance, and so individuals must have a child in the home in order to qualify for those funds. But now our expanded eviction funding that we receive from the planning department, we remove that criteria for those individuals. So we're reaching more citizens with that program. But even starting that program in January with $150,000, we have less than $90,000 in funds remaining, and it's only been 3 full months. So. And unfortunately, that is the state policy as far as how we can use those TANF EA funds.
So how would Pitt County, this is social services. In social services, we care for the needs of people and families. With that kind of money, and what argument can you present that can make a change or a difference in that? Because we do have, I saw a lady off of Mumford Road with a tent up one late afternoon. And this is America. This is Pitt County. And we are the best in the East. So what are we going to do about that?
I mean, if we are given additional funds, that we can definitely look at that, but we have to have the funding, which has to be approved by our county commissioners to assist with the homelessness here in Pitt County.
Can you tell us why? Do you do any kind of research or questions or anything that will give me good reason as to why we should do that?
Because to protect our citizens, just as you said, most of our homelessness individuals are our more vulnerable population, those that have children, those that are on fixed income. A lot of them cannot afford the high cost of rent now. We have individuals that receive Social Security that's about $1,200 per month. And here in Greenville, you can barely find a place for less than $1,500 a month unless it's subsidized. And a lot of times subsidized housing require you to have children in the home or whatever, or those other things that criteria, other criteria that those individuals do not meet. And also as a single mom, if you have a single mom, I'm not a single mom, but I've come across many single moms who work every day, who have decent jobs, but they can't afford the cost of living with the high cost of rent, the high cost of utilities, with food, health costs. There's just so many things. It's just the way that life is now with the cost of everything in Kristen. I mean, to me, that's explanation enough to assist. Not to get too personal, but we even have county employees who have to come in and apply for assistance. So the need is across the board, and it's not just unique to Pitt County. It's just a high cost of living. So to me, that is explanation enough to receive additional funding.
The reason I raise these kind of questions is when I go to various meetings, there are other elected officials saying that we're just throwing money at people to have it, and they don't have statistics or the need. And for some reason, it's like an ostrich. You know, your head is stuck in the ground, and you don't realize that a one-bedroom apartment is costing $1,000+ dollars. And when we have those kind of things statistically or whatever you can do that would tell the message rather than stand up and say, we have vulnerable people, the kinds of qualifying actions that can help convince the people that you're actually looking into it, that you're raising question, and you have some reason other than the fact that you just need it.
Right. And a large portion of our population who apply for our services are working citizens of Pitt County. And many of them are barely making above minimum wage.
What is minimum wage?
Minimum wage is $7.25.
$7.25 for
And-
minimum wage.
Yes, ma'am.
An
Yes, ma'am.
hour.
$7.25 an
What
hour.
would that buy?
Not much. I mean,
So
it
you
will not.
understand what I'm saying?
And-
When people are in, I hope I never get that way.
Right.
That when people are in elected positions and they come up with these things that they're just blowing and wasting time, and you don't want to raise a minimum wage when you're in these seats and you're making recommendations, what can $7.25 buy? And you have a family of, I won't even say 4.
2, yeah.
I'll say 2, because nowadays there's a lot of households with a mother and a child.
Right.
So there must be some way that you as social workers can help make the reason why there are other needs rather than just passing money on. And I'm not trying to be funny, but I am trying to say for some reason social services must justify, that's the word I'm looking for, why social services is important. There are a lot of things in this country changing, and when you make your career the reason why it is necessary to do a little changing and create some policies, then things will not get better. They'll get worse. So I'm not trying to put you on the
No,
spot,
ma'am.
but I am trying to say, since these are televised meetings, as to you sit on the dais and you say $7.25 an hour for a family of 2, you can get a loaf of bread, you can get a jug of milk, and I hear a lot of mumbling out there.
Well, that's because we totally
What
agree
about
with
a
you.
dozen of eggs?
Okay.
You know, what will for 1 hour? So this is why when you go to meetings, conferences, and you're in your position, you are making a statement for those people who cannot make the statement any other place.
I agree.
Okay?
I totally-
I thank you so very much, but I
totally
do what I can, and
I
I don't know if
totally-
we'll do it.
Thank you so much. No, I totally agree with you, Commissioner. Yeah, I totally agree
But I
with you.
do understand why the need is there.
Yeah.
And I still tell the people, find a hot spot, a sunny side, to plant a hill of cabbage and a pack of collards.
Yes, ma'am.
That might help a little bit. Thank you.
Thank you, Sonia.
Uh-huh.
Okay.
We're going to start our budget presentation, but before we get started, I'm going to ask Chairman Dancy if you could come forward with me for just a minute. I'd like to do a little demonstration before we get started.
Okay.
Now, Nancy, you gotta find a lot to put on the plate for $7.25 now.
So, I'm going to make you an official Pitt County social worker today.
Whoop, whoop.
I didn't know that.
Yeah. And so, prior to us getting into the actual budget presentation, I wanted to just kind of give everybody an idea of the types and the amount of cases that we carry. And it's not just in child protective or in-home, and it's also folks across the river. It's a little different, but I chose child protective today because I thought that was probably.
We need a mic, don't we?
So I'm going to, are these things of 10?
Yes, ma'am.
So what the state tells us is the recommended caseload size for assessment workers is 10 cases. And so, social worker Dancy, I'd like to give you these 10 see that these cases are various sizes, some a little bigger than others, but what I'm gonna ask you to do, within 45 days, I would like you to read through each one, become familiar with them, and at the end of the 45 days, provide me a summary on each of these cases from what you were able to garner from your reading. Do you think that's possible?
Wow.
10 maybe.
Okay. Oh, wait a minute, social worker Nancy, wait a minute. Drop your hands a little bit. Oh, you can't set your books down, you gotta hold on. Social worker Nancy, I know I just gave you 10 cases to start, and that's what you did, but you know what? I just had 2 or 3 staff give their resignations, and I have to take those 10 cases, and I have to redistribute them to everybody else that is here. So, I apologize for doing this to you, but here's 10 more cases. Now, there may be some form of fashion that work's been done on them. I can't guarantee it. You may have to start over with these. But in the meantime, don't forget about the 10 that you have that have been assigned to you. So, how you doing? Okay.
I have a question.
He's worried now.
He had 10 to begin with.
That's correct.
Now he's given 10 more because you had some resignation or someone has moved on. And he doesn't know what's in there. In order, he has to go back and go through all of those and make some determination to not only the first 10, but the second 10, because you don't know where it is that the person has left off.
That is correct, Ms. Mary. But social worker Nancy, and I feel so bad doing this, I don't really have a choice. I have 3 people go out on FMLA, all for legitimate reasons, and I hate to ask you to do this, but now I have to redistribute their cases as well. And so, are you able to hold on to these?
I think that's gonna do it.
Okay. All right. Now, I need you to go back to your first 10.
Okay.
Make sure that you get those done and find out what's going on in the second 10. But then, the last 10 that I gave you still require your attention. And, wait a minute. Oh no, one of your cases blew up. We're gonna have to take one out of the middle. Oh, sorry.
Okay.
Now, I know you gotta pay attention to these, but this one just blew up, so you kinda have to ignore what's going on here because this one needs your attention. Well, what are you gonna do with the cases in your hand? You gotta pay attention to them.
Right now, I feel pretty bad.
And I'm not gonna give you the last 10, because that would now give you 40. But as we go through our presentation today, you can set your books down, I don't want you to get hurt. As we go through the presentation today, I wanna be able to illustrate that we have caseworkers with 40 or more cases that are struggling to do what they can do on them. That we are not really doing the types of social work that we need to do for our families. And I know this was just an exercise, but it is what our social workers go through every day. I think the 10 cases that you've had, even though it might have been a little heavy to load, felt like, well, you tell me how it felt. I don't want to tell you. The first time I gave you.
It didn't seem bad, it's just 10 and 45 days, and you all, I mean, each one of them are gonna have their own individual, I mean, no 10 are gonna be the same. And so I can imagine going through trying to peel back the onion and getting down to the core of it. 45 days is gonna be pushing it for, I would say, 10, to be honest with you.
And so that's what assessment social workers are allowed is 45 days to take a case, do a complete investigation, get their document, do their documentation and notes, and then to move on to decide what's gonna happen with the case. So, what I just illustrated is 10 is probably substantial, and this is what the state is recommending. They've done a rather intense caseload study, but that's not our reality here today, and that's what I would like you all to hear. What we need, and I will tell you before we get started, I'm gonna be asking for a lot. Please please feel free to ask questions as we go along, and I have a lot of statistics and documentation. Thank you.
Thank you.
Yeah, you were good at it.
It seems unreal, doesn't it? That is a very good demonstration because each case is a separate mindset, and you can't get it confused. And then the people are calling, want to know, what have you decided about my case? My children is this and my children is that. What are you going to say?
Welcome to the world of the Department of Social Services, Ms. Mary. So, the first slide here just depicts all the different programs that fall under the DSS umbrella. So we have administration, which is our business office, the director's office, and the fiscal portion. Under economic support services, food and nutrition, Medicaid for adults, Medicaid for family and children, work first. Under our family support services, child support enforcement, emergency assistance and crisis intervention, Medicaid transportation, and through our social work programs, it's adoptions and child placement, CPS in-home, CPS intake and investigations, foster care case management, foster care licensing, foster care adoptive parent and recruitment. And under adult services, we have adult home specialists, adult protective services, guardianship, special assistance in-home, community alternatives, respite, and in-home aid. And so as you look at this gigantic list of services that are offered through the Department of Social Services, what I want to be able to say is we just don't deal with children. We deal with from before birth and to death and everything in between. And that is a huge lift for any organization. But I just want to make that point and from this first slide. So the alignment with our county strategic priority is to enrich the quality of life for Pitt County citizens through opportunities for improved health, welfare, and environmental concerns. So here's our responsibilities: providing protection for neglected or abused children, addressing citizens' food insecurities through food assistance, supporting access for our vulnerable citizens to health care, maintain health and well-being, paying rental assistance to a landlord that keeps a fragile family intact, and assisting with work support strategies to foster self-sufficiency. So I'm going to start with Medicaid first, and there's just a couple of things I'm going to emphasize throughout this presentation. So there are some misconceptions out there that a Department of Social Services, and I'll say specifically Pitt County Department of Social Services, use the taxpayers' money, not inappropriately, but because that money has to be given to the agency first and we end up getting reimbursed for it later, it would appear as though we're putting a burden on our taxpayers. And what I want to demonstrate through these slides is what we really do is bring more money into this county than it costs to run a Department of Social Services, Pitt County specifically. So we're going to talk about the multiplier effect for Medicaid. So we have, when people are on Medicaid, we have increased federal revenue. We also get state funds. And we have our total Medicaid spending. And from there, it comes down to we're using that insurance, or our citizens are using that insurance for health care clinics, hospitals, pharmacies, whatever their health care needs may be, which provides income to staff and vendor purchases, so rent supplies, so we're adding it into the economy there. Consumer purchases, because all of that, you know, those staff need to have a place to live and purchase things. The vendor purchases also do income to staff and vendor purchases, which comes back through to state and local tax revenue. So they're paying their sales tax, they're living in this community, and as they're getting their pay, it starts with our Medicaid dollars first and multiplies down through. So, just to give you a little bit of the economics of Medicaid, We have 56,973 people enrolled to date, which is about 33% of the population. And so the multiplier, and it says it's subject to debate, but we could reasonably estimate that any dollars that we spend are between $1.5 to $2 in a multiplier. So we have healthcare coverage for 33% of the population. Our Medicaid expenditures are $380,344,516. But the economic generated from this activity is $570.5 million. Does that make sense? So we have the same multiplier effect in food stamps and SNAP. So we have, people are getting their food stamps, they're purchasing food, and they can pretty much participate in any kind of store. We have our superstores, specialty stores, and convenience stores. And the same thing holds true. So we have 15,631 cases, 31,719 participants, and 22% of the households receive a SNAP benefit. So again, SNAP, the benefit generates $1.50 in economic activity. So it just gives a breakdown of what the monthly income or benefit would be in the local spending, but generated in economic activity is $8.1 million. This is for Pitt County, not for the state. So, as we go through, I will tell you, the budget really consists of not many of our areas are we asking for additional money. What we are asking for is additional staff. For just as I showed Chairman Dancy a few minutes ago, we are struggling with our vacancy rate, but the problem is people don't want to stay in a place where they're overloaded with cases, where we can't give them a good work-life balance. And so if we can get our vacancies filled and add more staff to be able to distribute the cases more evenly, to give people that 10 caseloads on their 10 cases on their caseload, I think it's going to add to the value of what we can offer our people. So you're going to hear a lot about numbers now for what we're going to be asking for our staffing. So it goes through a couple of things. One thing is to ensure child and adult safety and protection. And I will tell you now, as the director of Pitt County Department of Social Services, we struggle to do that based on our caseload sizes currently and what we're being asked to do. That we also need to maintain appropriate staffing for compliance and timely approval of Medicaid and food stamps, and support our workforce retention and employee morale through sufficient resources to accomplish this. A little bit later on in the presentation, I'm going to show you a survey that was taken for our Pitt County child welfare side of the house for you to take a look at where staff morale is at this point. So I'm going to call Tanya Cannon, our business officer, up to talk a little bit about our revenues and spending. Any questions for me so far? Okay,
great. Good afternoon. My name is Tanya Cannon, and I'm just wanting to talk to you about our spending. So for 2022-2023, we were at $26.2 million. 1.4 million and 13.7 million came from federal and state that we were reimbursed. That 11.1 million was actual all-county money. And that was just for food and nutrition, Medicaid, social work services, crisis intervention, energy programs, Work First, and DSS administration. For the foster care board rates, 18 to 21, independent living, crisis intervention, and the LEAP, low-income energy assistance, that spending was at 2.3 million and 2.2. That's what we got back from federal and state, and 1.6 million was all county, for a total of 6.1 million. Comparing current year budget and next year's budget, we have gone up. Most of that is in salaries for employees, as well as the new employees that we are asking for. Thank Yes, please. Thank you. It has gone up by 17.5%. And about 21.5% will be county contribution, and 23.1% will be reimbursed by federal and state. The main budget changes that we're seeing for this coming up year is new positions, as well as the salaries we already have. Foster care board rates for all county, we have gone up double probably in all county money that we are spending on some of these kids. Most regular placements will not take some of the kids that we have, so we're having to spend all county money on that. Computer equipment, software, that all goes with the new positions. We will no longer have our sheriff's deputies for 4D. We are going to be doing the $30 per paper is what we're going to be paying for that, so we are not going to be spending that money. This says training and conferences based on what we have spent so far. We don't know that that's going to change for next year, but I've left it the same as it was for last year. And then our revenues, the $26,000 for contributions that we have up here, I believe that is donations and contributions that we get. We don't know what we'll get each year. Most of that is spent on foster children's Christmas and adult Christmas, things like that. We have the 1.7 million. That's the increase for federal and state revenue that we will be getting for the new positions. And then our outpost IMC caseworkers, are we still going to have those? We don't know right now. So if we still have those outpost workers, I think we have 6. If we still have those, we will get reimbursement from the hospital and ECU School of Medicine for those. Current budget, expenditure budget by program. So as you can see, the main costs we have are in services and income maintenance. That is our highest expenditure we have. That's also where we get most of our money back. And crisis intervention, we are no longer paying for most crisis SIP monies. That is coming directly from the state. The few that we have are because they will not sign up for the automatic deposit. So we do still have some. We just don't know how many that's going to be. We haven't had a full year of that yet. And as you can see on this next slide, most of our spending is for salaries. The rest of it is much smaller, but we do get money back on our salaries as well, depending on the expenditure, the revenues that they have for us. Some of them we do not get back 100% on. Some of them are capped. Medicaid, food stamps, I know those two are not capped. So no matter what we spend on those, we'll still get money back on those. Do you want to do this next part? Do you want to? That's what's right there.
So we're going to spend some time talking a little bit about our new positions that we would like to ask for. And everyone should have a copy of a salary comparison. I'll tell you that we probably need to do a more in-depth salary comparison, but I wanted to at least be able to present this much today with our budget presentation. So when you take a look at the counties that are there, we are probably one of the lowest in comparison for a starting salary. And that's really mostly throughout the counties that are listed there. Craven County is one of our surrounding counties, and if you take a look at that comparison sheet, they're starting their employees anywhere from $3,000 to $4,000 more, depending on the job. And Johnston County is probably the county that we're compared to most often because of its size and population. So we're looking at our position requests. So for Social work for child, we're looking at 32 positions. For administration, and that is to help with the telephone calls that we get, and I have a slide about the number of calls that we get every day. We have 3 people answering the phones right now, and it's almost impossible to handle what's being asked of them. We have social work for adults, 9 people. Medicaid, we're asking for 30, and FNS is 12. So I'm going to have, who'll come up to do our Medicaid? Brian? Okay, all right. Brian will come up and talk a little bit about the Medicaid and FNS positions that we're asking for.
Good afternoon. Today I have the program managers of our 3 sections of economic services with us. Terry Ann Burley will present about the request for her redetermination section. Thomas Knight will speak about the quality improvement section request. Teresa Sampson will present the intake section request. And then after that, we'll hear from our employees' perspective from Janice Purnell, who's here with us. You saw her earlier. She'll speak about the intake process, and Jamisa Mercer will speak about the redetermination process. So we'll start off with Terry Ann, your presentation.
Good afternoon. I'm Terry Ann Burley. I'm the Redetermination Program Manager. So my programs in Redeterm are Family and Children's Medicaid, Adult Medicaid, Long-Term Care, CAP, Special Assistance, and Food and Nutrition. And in your long-term care CAP and essay, we also take applications. So we have the Redeterm side and the application side for all 3 of those programs. So the positions requested for Family and Children's Medicaid recertifications, I currently have 16 positions. I am requesting 10 positions with Medicaid expansion when it happened in December, when it was effective. Redetermination did not receive any new positions. So at budget, we are requesting 10 additional staff members for Family and Children's Medicaid. So currently in the caseload for Family and Children's Medicaid with the 16 positions that we have, there's 43,665 active cases that are receiving Family and Children's Medicaid in Pitt County. That means per caseworker, they have active 2,729 cases. So that means an average around 227 recerts are due monthly per caseworker. That's just recertifications. That does not include your redeterminations, which are changes, your phone calls, your walk-ins. With 10 additional positions, that would bring me to 26 in Family and Children. That, of course, the active cases were 43,665. That would bring their caseloads to 1,679 per worker, and that would average them around 140 recertifications monthly, which is ideal, especially with the changes and then the walk-ins and calls. Of course, the numbers are increasing due to Medicaid expansion and the pending applications that we have in Pitt County. Currently, the state has extended coverage due to continuous coverage for the unwinding waivers that are helping with the recertifications being complete. So clients are going where their benefits are not terminated, they're actually being extended. The lower rates of reviews processed timely. Currently, we are not meeting those requirements due to the volume that we have in Pitt County and the staff. And then, of course, that caused backlog of reviews. In fact, we do have the RETA audit. So February 2024, those cases will be reviewed during the RETA, and if they find errors, then the county will have to pay back. And then, of course, we already talked about the Medicaid expansion. So next is your adult Medicaid. We have 5 current workers in that position, well, that program. So currently they have 10,116 active cases. So that is your population of the disabled or 65 or older. Currently they have 2,023 cases per caseload for a worker. That averages around 169 recertifications a month that they must complete. And with adult, you review resources also besides income. So they're more in debt with the recertifications. I'm asking for 5 additional positions in the adult Medicaid. That would bring us to 10 positions. So that would be around 101 recertifications per month. The state is automatically extending their cases if they're not complete currently. With the amount of new are approved for the 5 positions, that would increase our rate of being processed timely. And currently we do have a backlog that the cases are being extended. If you know about the MQBE program, that's the Medicare beneficiary, those run from January to December once you're approved. So all of those recertifications are due every December. So you could have 4,000 to 5,000 recertifications due in 1 month. And of course, the Medicaid expansion is increasing the volume in adult Medicaid too, because they could be disabled and they're not receiving Medicare yet. So they're eligible for full Medicaid. And also with adult Medicaid for RETA term, we complete admin applications when they want to be evaluated for a greater benefit. And also we do the SSI ex partes. So once they are no longer qualified for SSI, they're automatically set up through the Social Security Administration, then we have to evaluate them for all Medicaid programs. So next is the special assistance. It's the CAP Medicaid. It's also long-term care. So as many of you know, the special assistance in-home, the waiting, well, we had a cap on it, and there was a waiting list for SA in-home and also for CAP. Those have been lifted. So now we have an influx of applications for special assistance. All of those applications or applicants, they are face-to-face applications. They have to come in the agency and be seen for all of those. So we have an influx of clients coming into the agency. So right now, with long-term care, CAP, and SA, we have 6 workers. We have 5 that perform all 3 programs. I have split one of the positions to CAP and SA because long-term care is so detailed and it's a lot into long-term care program. I am requesting 4 additional positions for income maintenance 2. So those would be CAP and SA workers. So that would bring that department up to 10. So you would have 5 that will work long-term care and CAP, which are similar programs, and then you would have 5 that will work CAP and SA. SA is a different program than long-term care and CAP. But due to the influx with those 2 programs, where there's no waiting list, we have a lot of cases coming in, applications and cases to be converted over to CAP. So currently, we have 2,870. That is for long-term care active cases in Pitt County. We have 610 that are, I think that is for SA, and then we have 606 CAP cases that are active. We normally are the highest in the state for SA applications. Right now, we have 77 pending SA applications. We have 110 long-term care applications. 59% of our special assistance for the aged is processed timely, and then 64% is processed timely for the special assistance for disabled. We do have a backlog, of course. The state also could be fining us up to $100,000 a day according to our applications that are not timely. We do have untimely applications due to the staff that we have and the volume of cases that we have in Pitt County.
I'd like to ask a question. Is this a good place to ask a question?
Good afternoon. Thomas Knight, Quality Improvement Program Manager. I'm going to talk a little bit about the positions that I'm requesting. First of all, I'm requesting 4 income maintenance caseworker 1 positions, and also I'm going to be requesting 2 income maintenance 3 lead worker positions. In terms of the income maintenance caseworker 1 positions, I'm going to talk about a little bit about numbers in terms of the clients that come through the lobbies. The income maintenance caseworker 1s are the workers that work at the front desk, answer the phone, scan documents, and things of that nature. So over the 8-month period, which includes August through March of 2024, August 2023, we saw about 27,198 clients. And these clients this only includes the clients that dropped off documents at the front desk. The clients that registered at the kiosks that come in the lobby, it was 44,532 clients. That amounts an average of 170 clients per day that drop off documents, and 185 clients per day that simply just register at the kiosk. Now, this does not include clients that drop off their documents in the drop box. We have a drop box inside the building and also a drop box outside of the building. Those clients are not counted in these numbers. Now, the benefits of having additional income maintenance caseworker 1 positions, it would allow us to have a daily triage, and triage would be designed so the caseworker 2s that process applications and reviews, they won't have to see those clients as they walk in. Those clients will be seen by the income maintenance caseworker 1 positions. Also, there will be more opportunities for those caseworker 2s to not only process cases, to handle their phone calls and changes or whatever other tasks they may have to do. This will also allow more, the clients that come in that needs an interview. Right now we have clients that come in that may need an interview. They may not be interviewed the day that they visit the agency. So with the additional caseworker 1 positions, they can get their interview done while they're in the agency. So that part will be done. Also, there'll be fewer interruptions for the income maintenance caseworker 2 positions that process food stamps and Medicaid. Those interruptions would be limited by having the additional caseworker 1 positions. And the improvement of customer service overall, because now you are handling clients that come into the agency, they're being seen by someone once they visit our agency, rather than coming to our agency and then maybe getting a phone call later. Another benefit to having more caseworker 1s would be the notices that are currently sent by mail by the caseworker 2s can now be given to the clients in their hand while they're in the agency. So that back and forth will not be so much by mail or by phone. You will have that person right in front of you. And also the additional income maintenance caseworker ones could serve as backups. Let's say we have vacancies in the caseworker one's positions that we have now. They could back up those positions as well. And those duties would include working at our front desk, answering the telephones, doing our mail run, and scanning documents that we have to come in. Now, in addition, we have asked for 2 additional income maintenance lead worker positions, those income maintenance caseworker 3s. I asked for 1 for FNS and 1 for Medicaid. We have a couple audits coming up, including our RETA audit, where there could be a potential financial payback if those cases are not processed right. So these caseworker 3 positions will be responsible for reviewing those cases for accuracy and making corrections if needed. So when the audit comes, we don't have those financial paybacks. We also have a food stamp management evaluation coming up. So we can get ahead of that with having additional staff to reduce the errors. So those are not found in that management evaluation. Now this will reduce the financial payback for the county and the citizens, because some of the errors are worker errors, but some of the errors are also client errors. But if we can get ahead of that, we can avoid those errors before they happen. Having the additional caseworker 3s would allow us to just review more records. The more we review, the less chance of making an error also. And we will be able to provide more remedial training for our staff. So once we have audits, those particular type of errors will not be found in audits. And also we will potentially have improved accuracy ratings for our staff, because right now we feel like, they're trying to get it done fast, so clients can get their services. But if they can have time to slow down and actually focus on their cases, this could be beneficial for both our staff and the clients. And the last thing, the improved performance evaluations for our staff, because their evaluations may not be as well as they could be, but they're trying to do their best to get cases processed. And in that process, they may be rushing to get it done rather than taking the time to get it processed right. And that's all I have. Thank you.
Good afternoon. My name is Teresa Sampson. I'm the intake program manager. And in intake, we take all the applications for Medicaid, except for CAP, SA, and long-term care. We do all the food stamp applications, we do Work First, and we maintain the adoption foster care Medicaid and process those for that. We're asking, currently I have 11 positions for food stamps. Our food stamp population has increased a great deal. Since COVID, it's just gotten larger and larger. We used to get maybe 500 applications a month. We are now into 1,200 to 1,400 applications every month that we're receiving for food stamps. Come June 1st, everybody has to be interviewed. There's no longer any interview waiver. The state requires, I'm asking for 5 additional positions. That would give us a total of 16 intake food stamp caseworkers. That would give them, so that they were processing approximately 82 applications a month. One application sometimes can take a couple hours because you have to really dig and look at other cases to make sure they're giving you all the information. We're required by the state to meet 95% standard rate. We have not met that since July of last year. At that point, our timeliness was 62.24. Our state rep is very supportive of us, and she says she knows this is not Pitt County. We've always met that rate, 95% or above. Currently, we are not. Right now, we have 2,100 applications pending, and I have 4 workers, one of which is retiring. And another one that's being going upstairs. So And I have four that are in training. So those 5 additional positions could really help us. It would help the workers. They're burned out at the end of an 8-hour day. It may not be physical, but mentally, many of them go home just stressed out. You know, you're not only working, you're trying to process these food stamp applications to help help a lot of the elderly, the disabled, families that are struggling to make ends meet because of the economy. And then they have to go home and deal with their family. So the work-life balance is just not really there anymore. We're asking them to work overtime. We're asking, comp hours. We ask them to come in on Saturdays. Some of them take laptops home and work from home after hours, just trying to process these cases. So those 5 additional cases, and what we process, once we approve it, it goes to our redetermination unit, so then they have to maintain it. So it's just a cycle. So, thank you.
Okay. Okay. So for food and nutrition for redetermination, currently I have 16 total positions, but it's broken down. There's 13 positions that currently they handle the timely and untimely recertifications, and then we have 3 workers who complete the late recertifications. That means they turned in their recertification after the month that their certification was due. Those are admin applications, so they follow the application process, a lot of the policy. So we have expedited with those, which means they have to be done within a certain amount of time. So we have 3 workers that actually do that. So there are 13 current workers that work food and nutrition for redeterm to complete the recertifications, the changes, and all the phone calls. Currently, we should be reaching the 95% for the timeliness for state. Currently, for February, we're at 56.63% timely. There is a slide that shows right now, per case worker, there's 1,147 cases active. That means they complete around 191 recertifications a month. My plan is that if we are approved for additional positions, I'm requesting 3, then intake would have the process of taking over the lates, so then we would not handle that intake process. Currently, right now, we have 1,485 pending recertifications for food and nutrition. 831 are past due, and 654 have already came in for the month of April. So you can see the volume that we've received already and the date that it is. And on that slide, it did show you, if we are approved for the 3 additional positions and the late recertifications would go to intake, then that possibly could put me at 19 positions. So that's around 131 recertifications per month for a worker, which is ideal with food and nutrition. I also am requesting 4 additional supervisors. I currently only have 3 supervisors for redeterm. So for family and children, I have the supervisor supervises 16. And then for food and nutrition, they supervise 16. And then I have an adult CAP and SA supervisor. She also supervises the adult Medicaid, which is, has 5 workers there. So that would be 11 that the long-term care CAP, SA, and adult supervisor supervises directly. And the other 2 supervise 16. So that is a lot to supervise. As you know, the numbers that I just went over that are coming in for food and nutrition, family and children, then you have your long-term care CAP and SA and your adult Medicaid. So in addition, that's why I am requesting 4 positions. So I wanted to branch out the supervisor that supervises long-term care CAP and SA and adult Medicaid. Long-term care CAP and SA require a lot of supervision. Those cases are very detailed, and you have transfer of assets, over resources. Those cases are very detailed and can take a while. So if the positions are approved, then that supervisor would supervise only long-term care CAP and SA, which would be 10 caseworkers. Then there would be a supervisor just for adult Medicaid. And then you would divide out, you would have 2 supervisors for family and children, so then possibly you would only have 9 caseworkers that you supervise instead of 16. And the same for food and nutrition. It would be 9 apiece instead of 16. Because 16 supervising, and you have 43,000 recertifications for family and children a year, and a month you can have like 5,000. So that's a lot to supervise. So I wanted additional 4 positions for supervisors. And that's all I have. Thank you so much.
Does anybody have any questions before we go for the staff perspective? I think what we're gonna do is hold the staff perspective to the end, to make sure that we have time. And I think we'll just continue on because we have quite a bit more to cover, but we'll call them up.
What'd you say?
I said, we'll leave the staff perspective to the end because we're gonna run out of time.
Okay.
'Cause I think there's another meeting in here after, so if you're all right with that, to get through the presentation, and then we'll have the staff speak at the end.
Can we take a quick pause for any questions on economic
Oh,
services?
absolutely.
So, is there any questions from the board? Do you
I
have
don't
any
even know where
questions,
to
Commissioner?
start. I don't know where to start because my question went back to SA, which are the very difficult ones it seems to be, and then you don't have enough. This is a very grim picture I'm getting. And
Miss Mary, could you speak into your microphone?
oh, thank you. You're recommending changes. Have you tested them? I'm trying to get to the brief part of my questions because you're the one that started my question with the S and the A and the complicated one with the long-term care. And I was doing all right until that point. So now I have a page for stuff, but what I wanted to know, have you tested some of the recommended changes you think you might have? Have you had a sample of testing to see if it will work? Will it change any of the time period and reduce the errors? Because that would mean that the county would have to pay for the errors you make, correct?
Yes, and those are your high dollar programs.
That's
as
what I'm
you
talking
know.
about.
Yes, ma'am. So currently, we have 2 functioning long-term care CAP and SA workers because we are fully staffed right now with 6, but you have training. And with that training, it's very detailed. So you have to learn adult Medicaid first. You have to learn CAP, you have to learn long-term care, and you have to learn SA, special assistance. So those are 4 programs that you would have to learn. So I have taken one of the positions and reclassified with the approval of the state and Ms. Rochelle and Brian to be a CAP and SA to try to keep retention in that program back there in those 3 programs. Retention is hard because that is a very demanding position and it can take a toll on you mentally with knowing all the policy. We deal with a lot of attorneys, the county attorneys, the local attorneys, the social workers. So with the SA in-home, it affects us, but it also affects the SA in-home social workers here because they would have to go out and do a home visit. But what we're having an issue right now is for the caseworkers actually able to process cases when you have such a high volume coming into the agency that are applying for special assistance, and they require face-to-face applications per the policy. So we are trying, but the volume, you could try so much. They have worked overtime. Overtime has ended, of course, but they have been working overtime for almost a year. A couple of those work 20 hours extra a week. And then we have a contract, 2 contract workers that work 20 hours a week that are trying to help with the long-term care CAP and SA.
Lord have mercy. The errors.
Yes.
The errors, ERRORS.
Yes, ma'am.
Weighs on the tax dollars that the local entity must cover. And you're not meeting the standard of 90. This is a lot of numbers to keep in my head. So
With the Medicaid, it's 96.8, so 97%. But we're not meeting that.
that's
no.
what I'm saying right there.
No.
Okay. And the only thing that I've been getting in the past, and I know it might seem hard that I was hitting at you on Brian the last time when I was talking about statistics and numbers and people, and that's why, and I'm getting some of it today. But when you see a lot of vacancies, and this is a overview board, and this board is one that's supposed to be Checkpoint Charlie over things. And when you have a lot of vacancies and you can't find staff, well, I shouldn't say can't find staff, but staff is not available. Maybe that's a good way. I don't know how to put it. But that means that stress, morale, and mental anguish places errors on the individual who trying to determine all that stuff that he was trying to hold. How, in these changes, I'm trying to summarize my page, that you making these recommendations that would impact positively what is needed. Have you tested it?
So, Ms. Mary, I think as we go on throughout this, you're going to see that as a common theme. So in my almost year and a half here, I think the issue for Pitt County isn't finding people to come to work necessarily. I know our applicant pool has diminished greatly because we are in competition. We have the other counties that surround us. We have Trillium, who either take some of our employees and hire them because they pay more, they do remote work, there's no on-call or after hours, they work a normal work day. And then we have ECU in our backyard. And so I think we struggle because we can't offer that same kind of opportunity for them to have that work-life balance. I think we find people they do okay, they get overwhelmed. We don't have the relief to give them because we don't have the staff to do the work, and they leave. And then we just go through this cycle of we get people hired, we fill our vacancies, and then they leave because they're too overwhelmed and too stressed out. So I think it's filling our vacancies, getting these additional staff in place to be able to handle a manageable caseload. And it's not just in food and nutrition and Medicaid. You're going to hear from the rest of the folks in the children's services and the adult services. They're all struggling with the same thing, and it's not changed.
Ms. Rochelle,
Yes, ma'am.
I heard one thing that said to me that Pitt County has the highest, I don't know who it was now, Pitt County has the highest
Special assistance applications, if you're referring to that.
in the state.
Yes, and we've been there for a while. Yes,
That's, why is that?
Facebook, and they'll come from the same street and walk in the same apartment. So one day we can have 18 essay applications. So then you're not able to process the other two programs that you need to process or work, long-term care and CAP, because of the influx with the special assistance.
I want you to know this. I'm being honest with you. At a certain level, as being an elected official, you do get the opportunity to go into another area. And I served on the Trillion Board because I ran into something in the community that upset me. So I wiggled and got in that, and I wiggled and got out of it as well. But I want to say to you, when my antennas go up, I wiggle and find a way to try to at least see if I can clear it out, and it doesn't. So now I'm sitting here trying to figure out how any one of us in this position can help all of you. And I am just one county commissioner. I am just one on this board of 5 who can impact what we do along with Ms. Rochelle for the rest of you that will make it life really worthwhile for Pitt County residents. And that's the balance that puts on this position in addition to everything else. So if you can find out how to address what you're sharing with us, because nobody is smiling up here, and I looked over there 2 or 3 times, and then I whispered to the chair who didn't want to hear me, because he knows I like to ask my questions while they happening, and I don't know how you're going to be able to address with the Pitt County Board of Commissioners who don't get that exposure that, you know, what can have. So the rest of this board, who has probably more social services than I do, I have community services and common sense stuff. Yeah, they can be professionally equipped to break it down enough so that they can understand all of this without the whatevers. Because no way in the world that we will be able to cover the cost, and I'm being real now. Oh, and we are being televised, aren't we?
Yes, ma'am.
I don't want to be too real, but I'm telling it like it is. I don't know how we're going to be able to cover the errors because of the impact of the work that you have to do. Because you've been, I won't say sleeping and sliding and peeping and hiding, but you've been skipping around the real truth.
Well, we're not skipping today, Miss Mary. We're
I see you're not.
letting you know.
I'm not happy.
So I'd like to.
Y'all take over, because
Okay.
I don't know how you're going to answer the questions and put the impact up.
So we're going to start with our social work services. So it'll be, I'm going to have Keisha Adams Council come up first to talk about assessments, which is child protective services and investigations.
And some of this, all this protection needs because of the society. This is the first time I've had this much paper on in front of me.
My name is Keisha Adams Counsel. I'm the program manager for Child Protective
Well, you
Services.
need to pull your microphone up because I got a lot of pollen in my ear.
I usually talk loud on this, but I got some sinus stuff going on, so bear with me, Miss Mary.
All right.
Let's see. You ready? So, like Ms. Rochelle said earlier, we did a employee survey regarding child welfare as a whole.
Okay, this is getting good.
And with the utilization and help from East Carolina University. And some of the things that were identified throughout that survey was work-related stress, job demands, workload pressure, time pressure, emotional demands, interpersonal interactions, work-life balance. In the essence of time, I'm going to try to shorten and not read through all of this. You all have a copy. And so I'm going to
got a copy of it.
go through some of this and get to the nuts and bolts of our presentation. But some of the burnout and turnover is related to stresses of high caseload sizes, complex cases, and exposure to traumatic situations, and it's a continuous cycle. Right now, we have approximately 13 budgeted positions for CPS assessments, and you did the demonstration with the books. With our budgeted positions, we approximately have 308 cases currently open in CPS assessments. And if we were to go by what was budgeted, they would carry 24 cases. And that's 14 over what the state recommended thing is currently. But in actuality, we have one intake worker vacancy in assessments, and we have 6 social worker vacancies and assessments. So we currently have 7 social worker INTs working 308 cases. Out of those 7, 1 is in pre-service, so she's not allowed to touch any case until she completes that process. And the state went from a 3-week process to a 7-week process. So she's not able to get a case for 7 weeks. They say 7 weeks, but in actuality, the pre-service is now about 8 or 9 weeks because the first week is totally online and they have to look at modules. So that week not even counted. Then the next week is considered the core week where they go in and learn basic social work 101 information. Then the 7 weeks start. So it's actually 9 weeks before they can even touch a case. Then we have one worker who went through the pre-service process, but she lacks any child welfare experience. So we can't expect her to come in and get in full rotation and start taking on the demands of the job because she has to learn the job. And with the complexity of the cases and the families that we deal with, that puts her at risk as well as the agency and the county at risk. So we have to slow roll her. And then we have one person that's out, that's on FMLA. So she's not available to take any cases. And so that's 3 people out of that 7 that's not available. So basically we have 4 social workers that's receiving all the reports for the whole county of Pitt County to do the job with 308 cases. And they're tired. And I feel bad for staff. They don't think management understands, but we do. Because working for Pitt County, I started in 2006, and I was an assessment worker. And when I came to Pitt County, 6 people started with me that very day because Pitt County didn't have the staff. They were in the same situation in 2006 that we're in 2024. And out of those people that started with me in 2006, I'm the only one still left standing because of caseload sizes and the things that we experience in those caseloads. We got people with mental health issues, substance abuse issues, poverty, homelessness, just the whole gamut of issues that we face and we have to deal with. And those social workers, they go into these homes, and all they have is a badge and a smile. And they're dealing with people that are violent, people that don't want us there, feel like that we're intruding. So they face a lot of things and dangers just by showing up at that door. They never know what they're gonna face or see once they get out there and get behind that door. And I don't think people think about that necessarily as much. And I know as an investigator, I would hear from law enforcement when I would call them to say, hey, I need y'all to go out with me. Well, y'all don't go places we go. We don't go with backup. And they would tell me, I'll meet you at the store, but I gotta wait for some backup before they would come escort me to the house. But then as a social worker, I don't have that luxury. If I get that call, I'm going out there and I gotta do what I gotta do. Same thing with COVID. When COVID came, assessment workers, we didn't have that luxury to say we weren't going to that house or that things were shutting down for us during COVID. We stayed open. We still had to go into those homes. We had to get our PPE and put it on. If the family tested positive, we still had to go and do what we had to do to protect ourselves. So right now, with our vacancies, on an average, with the seven social workers that we have currently supposedly working, if we divided our cases out, they would be working 44 cases apiece, which is pretty much the demonstration that you saw. Some are working more than that because, like I said, 2 of those people that are in currently can't carry full cases or don't carry caseloads at all. Right now, we have somebody that's out on FMLA. When she went out just this past week, she had over 50 cases. So now we got to make sure that somebody's carrying those cases out of those people that we have to work with. And not just reading the case, we have to deal with contacting other outside agencies that may have some knowledge about the case. So it's not just reading it. We got to reach out to the school, law enforcement, doctor's office, mental health providers, any professional organization that may have worked with that family. We're required to contact them and get their information. So sometimes it delays us from completing the case within 45 days because we have to get that information. We have to talk to parental collaterals that they provide us with before we can make a case decision, as well as check our state databases. I know as elected officials, recently, we get a lot of complaints. We have to answer a lot to the state for the complaints from the constituents, from the people that we're working with on the cases that we have open, because they're going over 45 days. Because it's almost impossible to complete them within 45 days when you got 10. But if you got 40 and you got 50, you're not seeing those people, and they're not being able to close those cases within that time frame. And I'll just say, as a program manager, my day doesn't end. I don't have an 8 to 5. As a social worker, your day never ends sometimes. If your case blows up, our after hours team may call you to get some information about your case. As a program manager, if my phone rings and I see certain numbers, my first thought is, please don't let it be a fatality when you answer that phone. Because 9 times out of 10, that's what they're calling you for. There's some emergent situation going on where a child is not safe. There's something that happened, and they want to let you know before it hits the news. So children are not being seen like they should be. Are we keeping kids safe? We're trying to the best of our abilities. We're working with what we got going on. So 10 is our mandated caseload size. But as you can see, we're way above that. Some of the reasons why caseworkers leave their job, the majority of the time, is because of these organizational factors, such as the caseloads and workloads. Right now, we have 2 part-time supervisors that's currently helping us out. They went in retirement, but thankfully they came back because they know the situation that we're dealing in, and they said, we want to help you because we know what y'all are dealing with is virtually impossible. We have 7 part-time social workers who used to be social workers here, but due to the demands of the jobs, they left and went elsewhere. But again, they said, We know y'all got a lot. We want to help you. So they're here, and they're helping to the best of their ability because they have full-time jobs. They're only allowed to work 19 hours per week. Some can, and some can't, just to the demands of their job. But we're thankful for what we got and what they can do. Let's see. So high turnover rate equals negative impact to youth and families. And as I stated, we know per policy, we're supposed to see our children that we have open twice monthly. So within every 14 days. And that's not happening because it's virtually impossible for 7 people to see 308 families. That's not just, that's based on the mom. So think about it. If there's 2 children in the home or 11 children in the home, and we do have cases where there's 11 kids in the home, 8 kids in the home, those are the number of children that those social workers are required to see. Let's see. So our state mandate is 10 assessments per month per worker. Our supervisor to staff ratio is 1 to 5. We're supposed to meet closed cases within 45 days. 83 to 87% of our assessments are not completed timely. We've had 29 child fatality reports since 2021. And high caseloads impacting staff retention. And I know what's almost often that I've heard over the years since I've been here is, well, fill the staff you get before, fill the vacancies that you have before you ask for more positions. But my question would be, would you want to work someplace where you got to work 3 times as hard? So we can fill them, but even if we fill them, those people would have 24 cases, which is double what the state say they should have. So we do our best that we can to work on our staff morale. I know a lot of times they don't think that we understand, but we do. We hear that we're mean. We hear that we don't care. But I can tell you for myself, I do care. I don't sleep like I should because I do care. I know my staff is not sleeping like they should because they do care, because they know that they aren't seeing their families as often as they should. They know they're not practicing social work like they should and would like to. Let's see. Then we're requesting, so I'm going to try to speed it up, like I said, and get into what we're requesting. We're requesting 15 social worker INTs. We're requesting 2 additional on-call social workers. We're requesting 3 social worker 3s. We're requesting some social worker 2s, which will be case aides, and 2 office assistants. And the social worker 2s can assist by supporting our social work staff. Right now, we have 2 intake social workers. If they take off, they go on vacation, they get sick, we get a vacancy, those 7 social worker INTs have to cover intake. If they go to lunch, they have to cover intake. So not only are they doing investigations, they're covering intake. Today, we have 1 vacancy for intake, and we have 1 social worker that's usually covered, she's out for medical issues. So that means we have no assigned social worker covering intake. So right now, we're using our assessment workers and people from our in-home area to assist with covering intake. Today, our 2 workers that are covering are from assessments. So that's who's handling intake. We are asking for 2 additional on-call staff. We've had an increase in the number of assignments that our on-call staff covers, and I know I'm rushing it because I know time is of the essence. We're in Pitt County, we like to say we're resource rich. So we have the luxury of having ECU Vidant Health, the Children's Hospital right over here. We have the Eastern Regional Detention Center. The Village, which is an inpatient substance abuse treatment facility for mothers who can bring their children to stay with them when they're doing their substance abuse treatment. We have Walter B. Jones, which is an inpatient substance abuse treatment. And I heard that we are also in the process of getting a children's mental health facility here in Pitt County. With all that being said, our on-call staff, we get what we call on-call courtesy requests. And basically, all 100 counties in the state, if somebody lands in Pitt County and they got an investigation and they call us and say, we need your help, we go out and do that initiation for them. And that's handled by our on-call team. Last year, we received 346 courtesy requests, which was an increase. In 2020, we received 240. 2021, we received 219. 2022, we received 186. And in 2023, we've received 346. A bulk of those are at the hospital. And these are usually our cases where children are in life-threatening situations, potentially a fatality. We've gotten where children have been shot, children have overdosed, parents have done things that's placed the children at near death, so they are flown into our children's ED because of it's a trauma center. So anytime we get those calls, our after-hours teams handle that. So they see a lot of trauma. We lost a really good on-call social worker just by the nature of all the trauma that they were exposed to from the cases that they see. And that's another reason why we lose a lot of our social workers, just dealing with some of the trauma that they experience day in and day out. And then when you're short-staffed and you experience that trauma even more, and then you can't necessarily hit everything like you're supposed to in the time frames that's set for you to hit it because you got 44 books to carry. So let's see. Then, as you all know, the state was here. We was in intensive technical assistance due to some of the same reasons that we're standing before you today. We've had several fatality reviews. This next slideshow talks about that. One of the common themes that's been identified throughout is social workers have been given administrative work, which could be completed by administrative staff. Fully trained social workers and supervisor staff were not sufficient for the caseloads. Deficient and full-time employees needed for case sizes. There was not sufficient supervisory oversight due to lack of time available to review files. Caseload sizes were very high. All child welfare staff were overwhelmed with the case sizes. Supervisors were carrying caseloads. Deficient in FTEs to carry cases when social workers left the agency. Current protocol was not sufficient to address staff turnover with high caseloads. And then in our most recent child fatality review, one of the findings and recommendations that the child fatality team put in that recommendation was that Pitt County Commissioners should address the critical needs for less turnover and caseload size in their local Department of Social Services to assist child welfare section in meeting the North Carolina state mandates for child welfare. Failure to do so may continue to result in ongoing child maltreatment and increase in child fatalities. So that was the recommendation and the finding from our latest child fatality from our child fatality protection team. Any questions? That's all I have. Thank you for your time.
Hi, I'm Colleen Anderson, and I'm the program manager for CPS in-home services. And Keisha did a wonderful job of painting a realistic picture of what all of our social workers are dealing with. So when they finish with the assessment and they decide that that family needs more help, they come to in-home services. So I'm going to talk to you about some numbers. My numbers are different than Keisha's numbers, but my workers are dealing with the same clients with the same issues. So in-home, we have budgeted 13 positions. So if all our 13 positions were full, one social worker would have 11 cases and they would see about 28 children. Unfortunately, all our positions are not full right now. We have 2 vacancies. We've had 100% turnover in the last 2 years. Of all of my staff, the one that's been here the longest has been here 18 months. We see our cases based on the risk score. So how Keisha was talking about, they see them twice a month, or that's what the state policy is. If the case is high risk, we have to see them every week. If the case is moderate, we see them twice a month. So when you look at that, we have about 145 cases open right now. 75 of those are high risk. So 75 of those families, we have to see every single person in the family every single week. So she broke it down in our slide where you see the 75, that's 325 visits. The 70, that's 140 visits. But that scenario is if all the individuals are in one place at one time for you to see them. That almost never happens. And even though it's called in-home services, we have children in temporary safety placements. So they're not living with their parents. So we have a case where mom went to jail and she had to make a plan for her children. So one of her children is living right by Shakad School with his grandmother. And one of her children is living in Aden with his paternal aunt. And one of her children is living with the godmother off Paladin Drive right around the corner. When mom got out of jail, she lost her house. So she moved to Snow Hill. So every week, to see one family, that social worker has to drive to Shakad, Aden, Snow Hill, and Greenville. And that's to see one family. They're carrying caseloads of 14 right now. So it's just not possible. The state mandate is also 10 for in-home services. Our in-home workers also conduct assessments. So once you get an in-home case, if a new report comes in on the family you're working with, it doesn't go to one of the assessment workers. They do that work themselves. So now they're working the in-home case with the needs that have already been identified, and they're also investigating the new report. So they're doing child and family team meetings, they're trying to get families to make changes, they're trying to take people places, and they're trying to investigate whether this new information is true. We've had a 26% growth in new cases. We served 274 families in in-home services last year. At the end of March, we've already worked with 186. So in just 3 months, we've already worked with 186. Assessments has shared their numbers with you. That greatly affects what happens to in-home because it comes straight from them to us. If they can't get to those cases timely, then sometimes they can get a big push and they can get some part-time people and they can send a whole bunch at once. And then there might be a month where there's not as many because more reports are coming in and people are just doing the best they can. So in-home fluctuates a lot, but we stay around 130 to 140. 7% of our cases are courtesy cases. It's the same thing that Keisha was sharing with you. Because we have the hospital, because we have the village, because we have more resources than a lot of our smaller counties, a family may go to the village and mom takes her children to the village to do her inpatient substance abuse treatment. Well, that doesn't make her a resident of our county, but that does mean that that county needs her to be seen every single week, and they're gonna call us, and that's what we're gonna do that. So we're gonna be doing all of the legwork for that case. Keisha talked to you guys a lot about turnover and high caseloads. So that affects the staff. Obviously, it affects the amount of time that a worker can work with a family. While we monitor and ensure safety, and in-home, we have to facilitate change. We have to motivate families to address the behaviors, like substance abuse, mental health, domestic violence, directly impacts the safety of their children. With a high caseload and less time with the family, we get more reports. We get more repeat maltreatment. We get workers that are now working their in-home case and their investigation. With that also comes more legal action. We end up filing more petitions, taking more families to court, taking more children into custody. We don't have the time to do the quality work to motivate people who are not necessarily interested in our help to help them see what the change could be for them, what they could do for their children to ensure that their children are safe. So I'm just asking for one social worker IAT that says it's an in-home floater, so that person could float into the position that we needed. So we have somebody who's pregnant. When they go on maternity leave, they could go right into their position. When somebody is out sick, they could handle whatever comes in for them that day. When we have a bunch of courtesies, we typically have several of those. They can handle some of those. We get court motions, they can handle some of those. When we have vacancies, they can move into that vacant position. And as we're able to fill those assessment spots, we can expect more cases to come to in-home. Also, I've asked for a social worker 3. That is to be a child and family team facilitator. And that facilitator would be used by the entire child welfare division. So assessments would use that facilitator. Anytime we take custody, we have to have a CFT. We have to have a child and family team meeting. We have to bring that family around the table, and we have to say, what else can we do? Is there anybody else in your family who can help us? Is there anybody who can take this child? Is there any way we can prevent taking custody? And this is what the court process looks like. This is what custody looks like. We have to, by policy, do that. And anytime a family requests a CFT, we have to have a CFT. So assessments typically are doing them when they take custody, when families request them, and when they may just have a very volatile case where they need to get everybody around the table and really talk about solutions. In-home has, the reason that it's typically, we looked at it being placed in in-home is that we have several different time periods during a case that we must have a child and family team meeting. 30 days after it comes to in-home, we have to sit down at the table with that family and we have to say, what's the plan? How are we gonna meet the needs? How are we gonna make the change? How are we gonna keep your kids safe? And then every 90 days after that, we have to have another one. If we decide to take custody, we have to have one. If we decide to take the family to court, we have to have a child and family team meeting. If the family requests one, we have to have a child and family team meeting. Every 90 days, we have to have a child and family team meeting. Permanency planning also has to have child and family team meetings. They have to have one within 30 days to make their plan. Every 90 days, just like in-home. Every time the court changes a plan. Every time something new gets put into a plan. When the child moves placements. So we don't have a CFT facilitator right now. We have a few workers who are trained to facilitate CFTs who try to help out each other. But mostly workers are having to facilitate their own CFTs because it's better to have a child and family team meeting without a facilitator than to not have one. High-risk cases, policy says you must have a facilitator. It says if your case is moderate risk, that you can facilitate it yourself. But sometimes high-risk cases, they're having to facilitate themselves because there's not somebody else available who has the training, who's able to do it. So that position would be able to help us make sure we're meeting all of our policy needs, and the child and family team meeting is the plan that drives the entire case. So it's a very important position. And then I have also asked for an office assistant. One, we have 2 office assistants right now that are used by all of child welfare, all of Keisha's employees, all of my employees, all of Rhonda's employees. We're talking about a lot of people. And they're doing a lot of stuff for other areas as well. It's just impossible what we're asking them to do. We could add, if we had, so I'm asking for one for my area, just like Keisha was asking for one for hers, and they could not only do the things that they already do for us, they do a lot of keying, which allows us to pull the state funding for the salary for the job. But they also run background checks, CPS checks, LexisNexis checks, help us find people, help us make sure that these places are appropriate. And if we had one devoted to us, we could use them for other administrative things that the social workers are doing right now that could be taken off their plate so they could spend more time doing quality social work and helping the families. I think Keisha talked about not sleeping well. I don't know if any of us are sleeping well. This is a job I'm proud of. This is an important job. We affect people's lives. It's really important that we do the best we can. That's all I have.
Good afternoon or evening. I'm Rhonda Dawson. I am the Permanency Planning Program Manager. I am not asking for nearly what everyone else is asking because, believe it or not, I feel like we're in an okay situation. We're asking for what I think we need to have to help make our social workers that we currently have hopefully stay. One of the things that I am looking at asking for is an additional social work 2 position. Currently, I have 2 social workers that are split: foster care, licensing, placement, and training. So I have 2 ladies that are split into fourths. And one of the things that we're running into is foster care is always going to take priority. Because those are the children of Pitt County. They have deemed to be the most vulnerable as they are in our care. So one of the reasons I would like to have another social work 2 is that position would be dedicated to working to license more homes here in Pitt County. Currently, we have 20 licensed homes in Pitt County, and we currently have 20 children living in our 20 licensed homes. In addition to the 20 in private agencies in Pitt County, we have 20 children in those homes here locally. The cost that we pay for those private homes ranges from $1,854 to $2,095. If those children are state, then we receive 50% of that money back. If the children are 4E or federal dollars, then we can receive 75% of that money back on each of those placements. In addition to that, we have children placed all over the state. We've got some in South Carolina right now. We do have children placed with relatives out of state right now as well, so that's a blessing in itself. One of the goals in doing this is trying to keep more of our kids here in Pitt County. Our social workers are traveling all over. We've got, for instance, we have one family. It's a sibling group of 6. One child is in Martin County, 2 are down in Fayetteville, another is over in Elizabeth City area, I believe, and we're trying to coordinate that because we're required to have monthly visits, at least minimum of once per month. If the court orders it more, then we have to have more frequent visits per month. In addition, we have to see every child on these caseloads at least at minimum 1 time per month. So you have, like, and Colleen's talking about having social workers drive just in the county. I have social workers driving all over the state, and outside of the state if need be, to see our children. So my ultimate goal is, I already have one social work 2, is to work with her to begin more recruitment. We were doing a lot of recruitment, and then COVID happened. Recruitment essentially stopped because a lot of the times we would do recruitment at different events in the different townships and things like that. With only having one person to do that, it makes it more difficult to try and hit at different events when I have already 2 social workers that are doing 4 different jobs. So I'm trying to make that more manageable in an effort to try and license more homes, which I'm hoping would also help eliminate some of our children being in respite. It wouldn't eliminate all of that just because our homes, our families are not equipped to deal with some of the behaviors that some of the children we do have in our custody have. In addition, As Colleen and Keisha talked about, with staff retention and things like that and why people leave, the biggest complaint that my social workers have is not the traveling, is not the long hours. People say that working in foster care is a lifestyle, and it very much is, because you're with these kids a lot. In some instances, you're as much of a parent to them. So it's not the work, but what causes them to burn out and leave the work is all the admin things that they have to do. In foster care, we have two admin people right now for all of child welfare and adult services. We have to have things keyed every month. Every one of our monthly contacts, so every time we see a child in our custody, it has to be keyed into the state database. Whenever a child goes to court, it has to be keyed into this database. Whenever we have permanency planning meetings, it has to be keyed. Every move has to be keyed. And that also is how money gets spent. That's how we track kids' movement and how finance ensures that the right people get paid for placements. The admin folks would allow my social workers to be social workers and not have to say, well, I can't go and do this because I have to do this paperwork, or I have to request all these records. Doing that paperwork piece, that admin folks can help. I'm trying to find ways to support the social workers that we have. I have 22 social workers when fully staffed. And that is the biggest thing that they say is they need help with scanning. Our records are huge, and foster care will never be paperless. I don't care what anybody says, because the legal documents that we have to maintain, including with adoptions, we have to maintain some of these files until forever. There's no getting rid of them. So that's the things that I'm looking at asking for, is a licensing placement social worker too. And that would allow my 2 social workers that are split into 4s to just be split as foster care, and they will be able to carry actually more foster care cases instead of having to have a lower caseload. And the effort to hopefully be able to license more homes and try and keep more money in Pitt County. Any questions?
Thank you.
Good afternoon again. I am Candace Franklin. I'm the program manager for adult services. The program managers that came up prior to me kind of gave a lot of information, and I would echo a lot of those same sentiments. But if I can, I just want to kind of connect the dots in a couple of areas for you. Rhonda talked about permanency and the children that are in foster care, and so adult services is the unit that picks up once those individuals turn 18 or 21 and they are still in need of protection or still in need of a decision maker, then they trickle down to our APS and our guardianship units. So right now, the slide is showing that our recommended caseload sizes for our APS and guardianship units are about 25 to 30. So in contrast to the child welfare division, where their recommended caseload size is 10, ours is 25 to 30. Right now, actual caseload sizes with our positions on any given day, social worker caseloads can get up to 46. The caseload with new positions, if we were to get the positions that we are asking for, that would bring those positions, those cases down to 27. Our APS and guardianship unit has experienced an 18% growth in APS and then a 12% increase in guardianship. So from July 1 of 2024 to yesterday, the agency had received a total of 460 screened in APS reports. And again, that's an 18% increase from last fiscal year. The guardianship cases, currently right now we have 215 guardianship cases, which is a 12% increase, and that does include assessments. So even though, so what happens is maybe the hospital will call and make a referral for an individual that they believe is in need of a guardian or in need of a decision maker, someone that is there at the hospital without family. We still have to go out and do those assessments. We may locate family that is able to become the decision maker, but that assessment still has to be assigned to a worker. So we have received, seen an increase in that. Pitt County APS screens an average of 59 cases per month. They screen those in, and they're actually assigned to workers, 59 cases per month. Currently, our unit, our APS unit, is staffed for 8 workers. We do have 2 vacancies in that unit. But for the month of March, we did screen in 58 cases. And so if you do the math if we were fully staffed at 8, that would mean that almost every worker would receive about 7 cases on top of the cases that they were already carrying. Child welfare has separate units where they have an assessment unit and then they have an in-home unit. So once the investigation is completed, that case moves to a different department. That's not the case in APS. So with APS, once the report comes in, the worker is responsible for doing the evaluation or the investigation piece. And then if that case is substantiated and they find that the person is in need of protection, they still have to keep that case in Adult Protective Services. They keep the case and they're responsible for providing that protection. They're responsible for going to Social Security and taking the client with them to apply for benefits, or going over to our Medicaid office and applying for benefits for those individuals. And so they keep that case, and while they're keeping that case, they're still getting new cases coming in. So another 7 cases coming in. So we have cases that are at 3 different phases. Coming in, we have cases in evaluation, and then we have cases that we're mobilizing services and providing protection for these individuals. Adult services is in Pitt County is very unique. So we do, just like child welfare, face some different challenges here that are unique to our agency and kind of specific to our area, like our hospital, the behavioral health unit, and our community crossword shelter here. So we do get a lot of reports on individuals who are homeless and who are in need of housing assistance and things of that nature. So courtesy requests, we get those from other counties as well, and we're receiving right now about 3 to 7 reports per month from other counties. Special assistance, our SA program. So that's the program that Terry Ann spoke about previously, and she gave you a lot of data around our SA program. So again, just to connect the dots there, her program manages the application part and the eligibility part of it. They take the applications face-to-face. The individual comes in and applies for it. Once the individual comes in and applies for it, then one of our social workers in adult services has to actually go out and do an assessment at the home. So every case that they touch and do an application for, a part of that eligibility determination is an assessment that has to occur in the home. If the person does meet the criteria and they are eligible for that service, then that case still stays with us in adult service and is assigned to a social worker. And that social worker is responsible for going out and doing assessments quarterly and having monthly contact with the family, with the individual's provider, and with the client. And so their responsibility is to ensure safety, wellness, and they go out to those homes to be able to do that. Right now, that SA unit, we only have 2 workers. We have 2 workers, and just as Terry Ann indicated in the beginning, we have the highest level of SA applications coming in the state. And right now, we have 146 cases right now that those 2 workers are managing. One of the ways that we've been able to maintain is to kind of pull workers from different program areas and then supervisors. So in adult services right now, all of our supervisors are also carrying caseloads, and if they're not actually carrying a full caseload, they're still assisting with case tasks to make sure that things aren't missed. So right now for our SA case management, the recommended caseload size again is 25 to 30. The actual caseload right now is 73. If we were to get the positions that we are asking for that position, for that particular program, that would bring us down to 24 cases per worker. For our in-home aid program, the in-home aid program is the program that we took the bid We just looked at the bid applications for that. So that's our in-home aid program. As I shared with you before, that is the program that does support our APS. It's for individuals that don't meet the criteria, kind of fall in that gap. They need assistance, but they don't qualify for Medicaid, but they're at risk for placement. And so that program is very important for our aging population because it allows them to be able to age in place and to be able to stay at home with family and receive care in the home instead of going into a facility. Right now, we have actually had to close that program, and we have opened a waiting list for that area because we only have one worker in that program right now. So currently, in-home aid is not receiving new clients. So we are asking for positions for that area as well. In addition to the additional staff that we are asking for, we're also going to be asking for some new supervisor positions to be able to support that staff. I stood before you, I believe it was in February, and we talked about the adult services unit and how we went through technical assistance and corrective action with the state and all the work that we did to kind of pull ourselves out from that. And so in that process, because we were short-staffed, I believe Keisha kind of spoke to this, we did have vacancies. We've had vacancies. I started here in 2014, and we had vacancies when I started. But the difficult thing is when we're faced with situations like that, when the state comes in, and a lot of times we know that we're not meeting the mark. We know that. But when you don't have enough people to do it, and it is an impossible job, you do your best. But when the state comes in for an unannounced visit and they find that our documentation is delinquent, we're not seeing people at the frequency that we need to be able to ensure safety, then what do you do? So I think that in the past year and a half, we've seen more staff present at these types of meetings than I've seen in a very long time. I've never seen this many people. We've had some people to leave. For different reasons. But I have staff who have made arrangements for their children, for someone else to pick up their children tonight so that they could be here. I have a staff member who canceled his donut date with his daughter tonight so that he could be here and speak to the need in our agency. It's very hard because we have people here at Pitt County who are really passionate about what they do, and you want to help people. But when we're asking for more positions and we don't get them, it seems like no one's listening. And it seems like, and like Keisha said, sometimes the staff feel like we're not asking for it or we must not be saying something. So they come, and they're coming now to be able to ask for themselves. So we're in a different place. We're in a different season right now where people are speaking up and they're advocating. And so I am proud of all the workers who showed up here today and to all the meetings that we do come to kind of give voice to what we're going through. Burnout and stress, it's real. It's real, especially when you care. And the things that we do, you talked about the homeless population and the individuals that are trying to seek services through SA to be able to stay at home. It's impossible for us as social workers to go into these people's home and not care. And so we do take that home. We do take that home with us. And then when you have the state to come in and they ask you, how did you guys let it get this way? Did you not know? How did you miss when you're holding 40 cases and they're asking you, how did you miss this on case number 10? And you know that you've asked for help. You've asked your board, you've asked the commissioners, hey, can we get new positions? And where they're not awarded to you. One of our program areas, I believe it was guardianship, did not receive any new cases for several years. I think the last, when I was reviewing the documentation, the last time that they were granted positions was in 1997. So from 1997 to 2021, they were not granted any positions in that particular program area. So at this point, even though we have vacancies, what we're saying is we're behind. We're behind the times. Even if we fill those vacancies, we have not done a good job of keeping up with the trends of the community and what's going on in the population here in Pitt County. So when we have people who take FMLA or when we have people who leave to go and take other jobs, Chairman Dancy, when he was standing up here and he's juggling all these cases, the load would have felt lighter if you had the rest of the board up there with you. If you had more people up there. When one person left, it might not have felt as bad if you had Ms. Perkins up here with you to kind of carry some of those cases for you. So what we're asking now is, and you asked earlier, has this been tested? Have you tried this? So I had the opportunity to try it in adult services, unfortunately, because we were going through technical assistance with the state. And so the only way that I was able to help our unit to get out of that, or our division, was to utilize the entire division, because APS was drowning. We weren't keeping people safe, okay? And so even with all the staff that we had, it wasn't enough. So we opened it up, and every single staff person in adult services had to carry APS caseloads. So now we have staff that are juggling more than one program. They're all carrying APS caseloads. They're trying to get these essay applications completed and get the assessments done on those. And they're carrying these guardianship cases and doing assessments for individuals that are in the hospital. And so with 13 to 15 people, it still was not enough. So I have tested it. And so even with the positions filled that we currently have, if we had 8, it would not be enough. Right now, we're asking for, in social work, for APS and guardianship, we are asking for 4 positions. I would like 2 APS positions. That would bring the unit from 8 to 10, and then 2 positions in our guardianship unit. For our special assistants, our essay program, right now, as I stated, we currently only have 2 workers in that program, and we are asking for 4 new positions in that program. For in-home aid, we have 1 worker in that position, and we are asking for 1 new worker in that position. We are asking for 3 supervisors, 1 for each program area. So 1 for in-home services, 1 for guardianship unit, and another for the APS unit. We did ask, we have some staff who wanted to come and kind of give some perspective, and I hope that we are able to get to that point. I wanted to share a little bit of my own perspective and personal story as well. I started here in 2014. I started in 2014 as a social worker. So when we talk about eras and the burnout and the stress, I know that feeling. I understand what workers are experiencing now. In 2014, like I said, we were understaffed then. I promoted to supervisor in 2017. We were still understaffed. Unfortunately, in 2019, it got to the point where I couldn't handle it anymore. And so I left Pitt County. I left Pitt County DSS, and I sought employment elsewhere. Because it is difficult when you're asking your program manager, when you're asking your director, hey, can we get more positions, and they're not available to you. And it's hard to sleep at night. And so I got to a point in 2019 where the only way that I could sleep was to keep a notepad by my bed, so that in the middle of the night when I thought about a client, when I thought about something that was told to me in staffing, when I thought about an adult that we didn't see that day, I could jot that person's name down or jot that situation down. And then I could trust myself. I could go to sleep knowing that I wouldn't forget to do it the next day. I wouldn't forget to follow up on that person. So in the middle of the night, I'm making a to-do list for myself just so I can sleep, just so I can know that tomorrow I won't forget this person. And that's where our staff are now. They're losing sleep, not because they don't want to do good, but because they need your help to be able to sleep. They need your help to be able to provide the level of care and the protection to these people that we should be, because they want to. They want to do that. They don't want to have the state to come in and say, hey, how did you miss this? Why aren't you asking for more positions? Why aren't you guys fully staffed? So they're here to ask for positions, and we are in support of those requests. So that's all I have for my staff.
Thank you all for your attentiveness. I appreciate it. I've got just a couple more slides for you to take a look at. So one of the common complaints that probably comes through my email or across my desk, I would say multiple times a day, is that people will say, I can't get a hold of my worker. I have tried calling, nobody answers, their voicemail is full, there's a multitude of reasons. What I have on this slide right here, so currently I have 3 people answering all the phone calls for the Department of Social Services. So we were able to actually sit down and go through with MIS to talk about what, I needed to understand, why aren't calls being answered? Why are these going to voicemail or whatever? So every day, if you take a look at the slide, 2,449 calls are answered. That's what comes through the switchboard in the front. for 3 people to answer. That's 816 calls per employee per day. I'm asking for 2 more folks to come up and help for a total of 5. But you can see that only 44% of our calls are being answered because there's just so many that what'll happen is somebody gets put on hold. They won't, leave a message and they hang up, and that's what an abandoned call is, and then they'll call back. So it is this constant, I understand people being upset and not being able to get through, but there's just not enough people to be able to answer the phone for that. So I'm asking for just 2 additional staff for up there, just to be able to help with the number of calls that we get every day. So this is the breakdown. It's pretty much 50-50 county cost and administrative share. This last slide, I just wanted to present it to you because I realize, and as I said in the beginning of our presentation, that DSS is viewed sometimes as a burden on the taxpayers. But what I wanted to do with this slide is to be able to show you the amount of an economic activity that's generated by our Department of Social Services, what the county share is, and what the state and federal share is, to let you know that we really are not a burden. We add to the economy. We help the people that maybe no one else will help, but we're willing to do what we have to do. And I say that by I know we've asked for a lot. I know these are a lot of positions. Last year, when it came budget time, I could not ask for positions. We were not allowed to ask for positions. So I know this is a huge ask all in one year. Maybe if I broke it down into 2 years, it wouldn't have been such high numbers. But what I've come to know is that the people that work for Pitt County DSS are probably the most compassionate, caring individuals that I've ever worked with in my 30 years. And they try so hard to do the right thing by everybody. When they fall short, they feel it. And really what I'm asking for is just to get them adequate help to meet those caseload sizes, to be able to have them serve the citizens the way they deserve to be served. And, just to be able to meet those needs that currently are unmet. So, I know it's been long. Would you like to hear from any of the employees, or do you think you have a good idea of what it is we're asking for? Or
You're
let me
going
know.
down in sound.
Oh. Well, maybe they shut me off, Miss Mary.
What are you asking for? I like to ask my chair and my colleagues, what do you think we can do to get the point across? Or what can I do for this organization that Pitt County deserves so much as a board, as to convince the rest of my colleagues on another board to address the issue?
I can speak to that. I think this is the first time in my 6 years that the story has been told.
It is.
Like it should have been told. People learn differently, and having the books was a great visual for people that have different learning styles. Unfortunately, I think you're probably preaching to the choir, because we're on this board because we feel the passion. I've been in public health for most of my career, and when I hear this, it's overwhelming, and I'm just so proud to be part of this board, and to know that y'all have stuck it out. And I feel like we're on the right trajectory, but when you need 80-some positions, that may be a big ask. I feel like these stories need to be told to the commissioners. We've heard it from we know that Mary hears it, but there are, 10 more of them?
There are 9 of us. There are 8 others.
Okay, so there are 8 others. And, people have their opinions about social services, and, that it's a handout. Well, it's not. It's not. And so changing the minds of some people may be difficult, but if you can reach you know, a good number of commissioners and the people in your community. One of the things I was thinking while y'all were speaking is, wouldn't it be great if we could have like scenarios on social media that tell the story about what y'all deal with every single day, and people will hopefully, even if you went on the news and just said, this is what we deal with every day, and provide 4 or 5 scenarios, because it's very, very telling when you talk about what's happened. When I see that 29 children have died in the
That
last
hurts.
3
That hurts
years,
me.
that makes me sick. That's a classroom full of children.
Yes.
And so, I mean, I feel like that's really very tragic for our community. So I feel like that Sharon can certainly tell the story, but I feel like the commissioners need to hear it the same way we heard it, maybe in a shorter version, because you're not going to be able to talk as long there. But I do want, for me, please know that I am certainly behind having more staff to prevent fatalities, whether it's a child or an adult. And just improve their quality of life, not just keep people from dying, but just so people can enjoy life. And so that's part of, well-being is part of what we're part of here in Pitt County. So again, I thank you, and I do feel like this story has finally been told, and it's not pretty. And I think that we can, make some strides, but I want y'all to be patient, because I don't think we'd get 85 positions at one time, or however many it was it 85? I don't think that's gonna happen overnight, but I think you've already been patient, because you're still here, you're still sitting here at 6:30 on a Tuesday night. So, but anyway, that's how I feel, and I'm just real proud to be part of this group.
Mr.
Thank
Chair,
you.
can I make a comment as well? Thank you. I'm going to 100% agree with my colleague, Catherine. We are not the choir that you need to preach to, and I am so incredibly grateful to have sat here and heard your story. I am so thankful that I got to hear from each of you what you do day in and day out. I've sat in those chairs in a county commissioner meeting many years ago when our teachers were asking for a supplement increase. We filled this room, we filled the emergency overflow room of teachers, of parents, of community members, and I don't know if Miss Mary remembers quite how long we sat here.
We remember.
It was many, many hours of public expression before their meeting even began. But we walked into this room thinking that it would not happen, and we left with a vote where it did happen, because hundreds of people showed up and they listened to us for hours. So I encourage you to remember that your county commissioner meetings have public expression, and you are a citizen of Pitt County, and you are welcome to come and do public expression and share this story. I also encourage you to email individually, not all 9 at the same time, individually, a personalized note. Share a paragraph story with each and every county commissioner. Hi, I'd like you to know why we're asking for extra positions, because this is my story. You'll need to email 10 pages. They're not going to read it, but they'll read a paragraph from you. Okay? Get your story out there. We have one county commissioner here that we hope will share the story with her colleagues on that board. But know that there is power in numbers, and you have a voice, and there are places to share your voice. And we will back you all the way. And if they get mad that the building reaches fire codes, you can just blame it on me, okay? But I've watched it happen. I've sat in these chairs when we thought the county commissioners were gonna vote one way for a very important group of people in our community, and it went the way we needed it to, because so many people came. And you've got to share a voice of thank you. I had one county commissioner who said, you've turned me from a hard no to a soft no to a yes, because you started by your public expression by thanking us. So start with thank you. because they have a hard job too. They have a giant pie and it's only got a certain number of slices, and they've got to give it to the schools and the sheriff's office and the fire department and all the pieces of our community. So they have a hard job too. So start with sharing your thanks for them, but then make sure they hear your story. Okay? And thank you for sharing your story with us this evening. You don't need to convince us. Okay? I think that all of us can say, well, I'll speak for me. I can say that I agree that we need to ask Sharon to move this forward and to ask for this budget. We're not going to get 85 positions. That doesn't mean we can't ask for them, and we just keep asking. But while we aren't the ones that need to be convincing, that doesn't mean we don't need to hear it. We are on this board because we care about you and because we want to hear your voices. So thank you for filling this room today and letting us hear your voices.
I have a different solution. In addition to that, I know you all can hardly wait to hear it. Stand up, Mr. Kroon. Mr. Kroon is what is your title of your position?
I am the Deputy County Manager, Chief Financial Officer for Pitt County.
Did you hear that? In every board of the county, the manager, this manager, Manager Janice Gallagher, has assigned an administrative person to every board in this county so that she can get the full story. Today, we have one of the deputy county managers who sits in unity with this county commissioner. And I am inviting him to join me in making this story worthwhile for the Pitt County Board of Commissioners. Because it does take more than one. I sat on that meeting that night. And we broke rules because we were not supposed to give the teachers a supplement. That was not our position. I served the school board for 6 years. So today, I know some of you had to tip up and go out. But my goodness, there are more than 5 people here today, y'all, at the end of our meeting. There are more than 5. He stepped out and did what he had to do, but he came back. And it's not because of his position, it's because of duty, it's because he cares. I care. So here's what I'm going to say to you. That everything you do, you recommend to every resident that you see to listen to this board meeting on station, whatever. Come in, Miss
13.
Huh?
Channel 13.
All right, Jen, I know you know. Listen to station 13. And I'm going, Mr. Deputy Manager, I'm asking you to find out when this board will be aired. And then let's get it on the television so the residents will know. See, I got a different position here so that the residents will know that we care about them. And we are willing to sit here. And I can go back there and blow my nose so they won't see me out there in the audience. Because all of us care. So we're going to make our community know where we stand. I served on this board before 2014, and that's when I first got elected as county commissioner. And I was reappointed to it, and I never gave it up because I asked to remain, because there were so many different facts and facets of this board. And you aren't going to get it all. But I'm saying to you, have your friends listen to this board meeting because the proper story has been told. And our chair, who's the only man up here on this diocese, and he held the books. She picked the right one, y'all. He wasn't weak either. You notice that? He said, I can hold him. And he flexed his muscles. So you flex yours too. And let's get it done. And let's get the community know that the money that you make is not a waste. It may save one child in a classroom. And you notice today I didn't even crack a joke. And I usually do, because laughter is a healthy thing. But now I'm crying. And I'm asking you to help our positive. Look at that smile on her face. And I told her before the meeting, I said, I like to see you smile. Because this is a tough job, but I like to see her smile. So we are going to put a campaign on so that our citizens will know what you are facing every day in the community at large called Pitt County. Okay? Can we agree? That's what we need to do. So that the other 8 can join me and say, let's meet the challenge of the Department of Social Service Board as best we can. And I'm asking the day that our director, Mrs. Sharon Rochelle, presents her budget request, that every one of us be in session to support the ask. So we got a job to do, and let's do it well, and I can be sitting there, because I'm not going to talk until it's time to put up my finger. And I only got, well, so you understand what I'm saying? Am I heard? We understood? Do we agree? Yes. Thank you, Mr. Chairman, for your patience.
Thank you.
I'm finished, and those are my comments for today.
Thank you.
What's the next step, Jana?
So, all we need is just a motion for Ms. Rochelle to present this, proposed budget and meet with the county manager, and then, present it to the Board of County Commissioners during their budget workshops the first full week in May.
I'd like to offer that motion
I second.
to Ms. Rochelle, and by offering the motion, she has my full support.
I second it.
All in favor?
Aye.
Aye.
All opposed? Any discussion? Thank you.
Now I got another motion.
And I was waiting for it.
Are we ready?
Yes, ma'am.
I'd like to offer the motion that we all get up, go home, and get to working.
Can I have a second?
Second.
Thank you. We stand adjourned.
Thank you, everyone.
Thank you.